10 morning drinks that support kidney health and flush out toxins naturally. One simple choice every morning can decide how long your kidneys will last. Skip hydration and toxins build up. Drink the wrong thing and inflammation spreads. But drink wisely, and you can actually protect the filters that keep you alive. Research now confirms that certain morning drinks lower sodium levels, balance blood sugar, and boost kidney function in just weeks. Here are 10 powerful drinks that science says can keep your kidneys working when everything else begins to fail. Many people with kidney concerns wake up feeling slightly swollen, with the skin under their eyes tight and their fingers stiff at first. These are small signals of fluid retention. During sleep, the body slows its urine output and waste products become more concentrated. The kidneys wake up to face a heavier workload. When this happens often, morning blood pressure readings rise and creatinine numbers begin to creep up. The blood becomes thicker and the delicate filters inside the kidneys must push harder to remove the same amount of waste. This silent strain repeats every morning until small changes restore balance. One of the simplest ways to start is with warm lemon water. Scientific studies on citrate-rich drinks show that people who consume them daily have fewer kidney stone recurrences and healthier urine chemistry. The increase in urinary citrate protects the fragile inner surfaces of the kidneys, keeping waste from crystallizing. The benefit does not require large amounts. Just a small portion each morning provides steady support. It is not a quick fix, but a daily defense. Over time, this habit reduces the risk of stone formation and supports overall filtration. The best way to prepare it is simple. Pour 8 to 10 ounces of warm filtered water, squeeze in the juice of 1/4 to 1/2 of a fresh lemon, and sip slowly before breakfast or coffee. This timing helps the body wake gently without shocking the stomach or kidneys. Warm water flows smoothly through the system, allowing the first urine of the day to carry concentrated waste products without straining the organs. Those with advanced kidney disease or strict potassium limits should confirm with their dietitian before starting. People with severe acid reflux should avoid citrus if it triggers discomfort. While lemon water starts the process, it addresses only part of the problem. The kidneys also need protection from infections that often begin in the bladder and climb upward. The next morning, the drink focuses on defending that pathway, the cranberry morning rinse. Before we move on, I'd love to know where you're watching from. If you're someone looking to naturally ease kidney problems, make sure to subscribe to Kidnease and turn on the notification bell. And if this content helps you, type 1 in the comments. If not, type 0, I want to keep improving for you. Cranberries carry special compounds that act like tiny shields inside the urinary tract. These compounds, known as natural plant acids, coat the bladder lining and prevent harmful bacteria from sticking to it. When bacteria cannot cling, they cannot multiply or climb toward the kidneys. Instead, they get flushed away before they can cause harm. This process sounds small, but it changes everything for those who have lived through repeated urinary tract infections. It means the difference between weeks of antibiotics and days of comfort. Cranberry also supports cleaner urine by reducing calcium oxalate buildup, one of the silent triggers behind kidney stones. A morning rinse allows the kidneys to begin the day in a cleaner, calmer state, ready to filter without constant irritation. Research has shown just how strong this effect can be. In several human studies, urinary tract infections were reduced by nearly 1/4 among regular cranberry users. Laboratory and clinical research confirms that bacterial adhesion drops by as much as 70 to 80%. That simple barrier effect spares the kidneys from waves of inflammation and scarring that follow every infection. For many older adults, it also means fewer antibiotic cycles, which reduces medication strain on already tired kidneys. It is not a miracle or a cure. It is a form of daily maintenance that keeps the system stable. People taking blood thinners should consult their healthcare provider before using cranberries daily, since they can slightly influence how blood clots, and sweetened cranberry cocktails should always be avoided. They contain more sugar than fruit, which burdens the kidneys instead of helping them. This morning rinse is more than a drink. It is a signal to the body that protection for the day has begun. It restores trust in hydration, offering peace to those who have lived too long in fear of another painful infection. Each sip strengthens the body's natural defense, reminding the kidneys that they are not alone in the fight against toxins. Yet, while cranberry guards the surface of the urinary tract, another fruit works deep within the bloodstream itself, dissolving the hidden waste that silently stresses the kidneys from inside. That next drink is the tart cherry infusion. Some mornings begin with stiffness that feels deeper than tired muscles. The fingers resist bending, the knees ache slightly, and the lower back carries a dull pressure that never fully fades. These are quiet signals from the body that uric acid is lingering in the bloodstream. When this waste builds up, it forms sharp crystals that scrape along joints and blood vessels, adding invisible strain on the kidneys. Over time, those tiny scratches lead to inflammation that slows filtration and raises blood pressure. It does not take much. Just a few weeks of poor circulation or heavy meals can push uric acid beyond what the kidneys can easily remove. That is why a morning drink designed to lower this burden can change the rhythm of the entire day. One of the most effective and gentle options is a tart cherry infusion. Tart cherries contain a deep red pigment, anthocyanins, which are natural compounds. These pigments are not just color. They carry the ability to calm inflammation and dissolve uric acid before it becomes a problem. They act like internal cleaners, sweeping away microscopic irritants circulating in the blood. When taken regularly, tart cherry compounds help relax blood vessels, improve their flexibility, and lower the small surges in pressure that often appear during the early morning hours. Each sip gently opens the pathway for better blood flow through the kidneys, helping them filter waste without feeling overloaded. Scientific research gives strong support to this small fruit's power. Some studies show that daily tart cherry intake can lower uric acid levels by about 15%. Inflammation markers such as C-reactive protein drop by as much as 20 to 25% within a few weeks. Even improvements in filtration rate of 3 to 5 milliliters per minute have been recorded in mild kidney stress cases. These numbers may seem small, but to aging kidneys, they are meaningful. Every extra bit of filtration preserved today can delay kidney decline for years. What begins as a simple fruit drink quietly rewrites the way the body manages waste and circulation. The preparation is straightforward. Mix about 4 ounces of diluted, unsweetened tart cherry juice with water, or blend half a cup of frozen tart cherries into a light drink. Drink it before breakfast when the stomach is still calm and the kidneys are ready for hydration. This timing helps prevent sugar spikes and maximizes the body's ability to absorb the beneficial compounds. Avoid concentrated syrups or fruit punches marketed as cherry drinks. They contain added sugars that burden the kidneys rather than help them. Each serving naturally contains about 150 to 200 milligrams of potassium, which falls within the safe range for most people with moderate kidney function, as long as total daily potassium intake is properly accounted for. The body often responds quickly to this gentle support. Within days, joint swelling may ease, fingers feel less stiff, and mornings begin with a sense of lightness rather than heaviness. These are not coincidences. They are signs that inflammation and toxin buildup are calming down. The drink works quietly but consistently, restoring fluid balance and helping the body move more freely. Over time, this habit does more than comfort the joints. It protects the filters inside the kidneys from silent damage caused by poor circulation and lingering waste. Each sip delivers calm to tissues that have worked too hard for too long. It turns the body's morning fatigue into renewed energy and brings relief to those who have grown used to constant tightness. Still, the repair process is not complete. The kidneys also need help managing the blood pressure surges that squeeze them each morning. The next drink addresses that exact need, a soothing vascular strengthening tea known as hibiscus, the kidney pressure drink. Hibiscus has been used for centuries as a calming herbal drink, but modern research reveals why it matters so much for kidney health. Its bright red petals contain natural compounds that relax the smooth muscles in blood vessel walls. This simple action widens the vessels slightly, allowing blood to flow more freely. When the flow improves, the pressure inside those tiny kidney filters drops, giving them space to recover and function with less effort. The antioxidants in hibiscus also support the delicate inner lining of blood vessels, making them more resilient to the wear and tear caused by high blood pressure. This combination of effects makes hibiscus tea more than a soothing beverage. It becomes a quiet form of morning therapy. Studies show that regular hibiscus intake can lower systolic blood pressure by 7 to 10 millimeters of mercury in people with mild hypertension. That drop may look small on paper, but to the kidneys, it feels like a deep breath. Each millimeter of relief helps slow the decline that uncontrolled pressure often triggers. Improved blood vessel flexibility also enhances circulation to every organ, especially those that depend on a steady supply of oxygen, such as the kidneys and the brain. As the blood flows more smoothly, the morning fog lifts and the heart no longer needs to push as hard to move it. Preparation is simple and comforting. Steep 1 tea bag or 1 to 2 teaspoons of dried hibiscus flowers in 8 to 10 ounces of hot water for 5 to 7 minutes. Allow the water to take on its natural ruby color before sipping. It tastes pleasantly tart and slightly floral. Those who prefer a smoother flavor can add a small cinnamon stick while it brews. Avoid adding sugar, as sweetness undermines the benefit and adds unnecessary strain on kidney health. Drink it warm, ideally before breakfast, when blood pressure tends to peak. Anyone already taking blood pressure medication or diuretics should closely monitor their blood pressure readings when starting hibiscus. The combined effect can sometimes lower pressure too much. People on certain heart or liver medicines should also confirm with their clinician before making it a daily habit. Safety and awareness make this practice sustainable. The relief from this kidney-supporting tea is noticeable, helping flush out toxins and improve kidney health. The head feels lighter, the heartbeat steadier, and the eyes less tense. It creates a calm beginning that allows the kidneys to face the day with less force pressing against them. The body starts to feel balanced again, not rushing or struggling to maintain control. Yet blood pressure is only part of the story. True kidney health also depends on how well the gut removes waste before it ever reaches the kidneys. That is where the next morning drink plays its role, a prebiotic fiber water that strengthens the gut-kidney connection from within. Prebiotic fiber is more than just roughage. It serves as food for the beneficial bacteria that live inside the intestines. These good bacteria help break down uremic toxins, the same compounds that accumulate when kidney function slows. When these bacteria thrive, they act like a second filtration system, catching waste before it enters the bloodstream. Fiber also physically binds some of these waste products, carrying them out through stool rather than allowing them to build up inside. This process may sound simple, but it plays a major role in protecting the kidneys from toxic stress that otherwise never stops. The gut and the kidneys work in partnership. When one slows down, the other suffers. Keeping the gut active is one of the kindest ways to protect the kidneys without medication. Scientific research supports this connection. Studies have shown that people who add moderate fiber to their diets often see small but meaningful reductions in blood urea nitrogen and serum creatinine, markers of kidney strain. The reason is clear. Less waste circulating in the bloodstream means less pressure on the kidneys to filter it out. Regular fiber intake also helps with blood sugar balance, which protects the kidney's tiny blood vessels from sugar-related damage. It is a gentle, food-based form of defense that strengthens the body's natural cleanup process. Preparing this morning drink is easy. Mix 1 teaspoon of psyllium husk or another doctor-approved prebiotic fiber into 8 to 10 ounces of clean water. Stir thoroughly and drink it right away before it thickens. Follow it with another small sip of plain water to help it move smoothly through the digestive tract. The goal is not to flood the system, but to create gentle hydration that helps the fiber do its job. Taking it before breakfast allows the fiber to form a soft gel in the gut that binds waste throughout the day. This creates regular, smooth bowel movements that relieve pressure and reduce that sluggish, bloated feeling many people live with daily. Those on strict fluid limits should use this drink under supervision, as fiber requires adequate water to work safely. It is best to start with a small amount and increase gradually to avoid gas or discomfort. Within days, most people feel lighter, less puffy, and more energetic. The relief of waking up and knowing the body can cleanse itself naturally is often emotional. It brings back a sense of control and comfort that many with kidney disease lose over time. Each successful morning routine becomes proof that healing can happen quietly, 1 glass at a time. But while fiber restores gut movement and balance, another drink helps calm an uneasy stomach and early morning nausea that often follow kidney medications or slow digestion. It soothes discomfort before breakfast and sets a gentle tone for the day. That next healing drink is the Ginger Lemon Morning Brew. If you find this helpful, please take a moment to like this video. It may seem small, but it tells YouTube that this message matters and helps kidneys reach more people who truly need it. If you believe others deserve this knowledge too, tap that thumbs up. Now, ginger is one of nature's oldest remedies for nausea. It helps the stomach empty smoothly and calms the nerves that trigger queasiness. When taken in warm water, its compounds soothe the gut's lining, reducing that uneasy rolling feeling many experience after waking. This makes breakfast possible again. A settled stomach means food can be tolerated better, and better meals mean the body can maintain the muscle strength that kidney patients need for stability and recovery. Every sip works like a soft reminder to the stomach that it can start the day at ease. The benefits go beyond comfort. Ginger also has powerful anti-inflammatory effects that protect blood vessels and reduce oxidative stress. These silent sources of damage slowly wear down kidney filters. In clinical studies, ginger helped lower fasting blood sugar and improve markers of inflammation, both of which are closely tied to kidney health. When blood sugar remains steady, the kidneys face less pressure to balance fluid and waste. What feels like a soothing drink is actually part of a deeper chain of protection inside the body. Preparation is simple. Add thin slices of fresh ginger to about 10 to 12 ounces of water and boil for 5 to 10 minutes. Let it cool slightly, then add a small squeeze of lemon for freshness. Those who prefer a milder flavor can add a drop of kidney-safe sweetener. Sip it slowly while it is still warm. The warmth encourages circulation, clears morning gas, and eases nausea within minutes. It is gentle enough to drink before medication or breakfast, setting a calm tone for the day ahead. Those taking blood-thinning medicines should consult their healthcare provider before daily use, and concentrated ginger shots should be avoided because they can irritate the stomach. This drink is about comfort, not intensity. It creates a quiet start to the morning, one that helps the stomach trust food again and the mind relax before the day begins. Yet comfort alone is not enough. The kidneys also need stability in blood sugar and pressure, which rise silently when left unchecked. The next drink helps restore that delicate balance of the cinnamon water infusion. Cinnamon plays a remarkable role in supporting sugar control. Its natural compounds help the body respond better to insulin, allowing sugar to enter cells more efficiently rather than lingering in the bloodstream. This improved sensitivity means fewer sugar swings and less strain on the kidney's delicate filters. When blood sugar stays steady, the heart and kidneys work in harmony. Blood vessels stay more relaxed, and blood pressure becomes easier to manage. The warmth of the drink enhances absorption and stimulates gentle circulation, helping the body prepare for food in a balanced way, rather than reacting with sudden spikes. Adding a splash of unsweetened cranberry takes this drink one step further. Cranberry supports urinary tract health by preventing bacteria from adhering to the bladder and reducing the risk of inflammation. For people who already have kidney stress, this combination helps the body start the morning both cleansed and balanced. Cinnamon steadies the sugar response, while cranberry supports the kidney's ability to flush out what the body no longer needs. Together, they create a foundation for smoother energy and steadier numbers through the day. Scientific research supports these effects. Human studies show that cinnamon can reduce fasting blood sugar and improve long-term glycemic markers, such as A1C, in people with type 2 diabetes. Better control of these markers directly protects kidney function, reducing the long-term damage caused by sugar-coated blood vessels. The results build slowly, but with consistency. They bring noticeable stability, less dizziness, fewer afternoon crashes, and calmer mornings. To prepare, mix about 1/4 teaspoon of ground cinnamon, or use a small cinnamon stick in 8 to 10 ounces of warm water. Let it steep for a few minutes before sipping. Add 1 to 2 ounces of unsweetened cranberry juice, if desired, for added urinary support. Drink it slowly, about 10 to 15 minutes before breakfast. This timing helps the body absorb the benefits and prepare for the day's first meal without sudden pressure on the kidneys. Those with liver problems should avoid overusing cassia cinnamon, and this drink should never replace prescribed diabetes medication. It is a natural helper, not a cure. Yet for many, it becomes a small morning ritual that delivers calm instead of chaos. The reward is subtle but powerful: more stable readings, fewer sugar dips, and a lighter feeling that carries through the day. As the body adjusts, energy becomes steadier and confidence grows, reminding each person that progress is still possible. And while cinnamon and cranberry guard against internal spikes, the body also needs a way to stay hydrated without overloading the kidneys. That balance comes next with the refreshing cucumber mint infused water. Cucumber contains a high percentage of natural water along with mild compounds that promote steady urine flow. It helps the body release trapped sodium, which is often responsible for morning puffiness and swelling in the fingers or feet. Its cooling properties help maintain a balanced temperature and prevent the body from feeling heavy or waterlogged. Mint, on the other hand, relaxes the digestive tract, eases gas, and makes hydration pleasant for those who dislike plain water. The aroma itself encourages slower, deeper sips, allowing the body to absorb water gradually instead of sending it straight to the bladder. Together, cucumber and mint create a drink that refreshes the senses while quietly supporting kidney rhythm. Research shows that consistent hydration is linked to slower kidney decline. Water itself does not heal, but dehydration silently accelerates damage. Mild diuretic effects from cucumber and herbs help release excess sodium without stripping essential minerals. For many, this balance brings noticeable relief within days: less swelling, more energy, and clearer skin. To prepare, add 2 to 4 thin cucumber slices and a few mint leaves to 12 to 16 ounces of water. Let it infuse for 10 to 15 minutes before sipping. Drink it slowly throughout the morning, not all at once. Those on fluid restrictions should count this drink within their daily allowance. While cucumber is low in potassium, those with advanced kidney disease should still include it in their daily tracking. This small morning routine helps the body stay hydrated, supports kidney health, and flushes out toxins naturally. It restores trust that water can help rather than harm. The kidneys work best when they are neither overwhelmed nor deprived, and this drink teaches that balance. Yet, hydration alone is not enough. The body also needs steady strength. The next morning drink focuses on protecting muscle and energy with care, the low-phosphorus protein smart smoothie. For many people with kidney disease, weakness creeps in quietly. The legs feel heavier while climbing stairs, and the hands tremble when lifting groceries. This loss of strength often comes from muscle breakdown, a common problem when the body does not get enough quality protein. Yet, fear surrounds protein intake because too much can burden the kidneys. The truth lies in balanced portions of clean, low-phosphorus protein that nourish muscles without overwhelming the kidneys. That is what the low-phosphorus, protein-smart morning smoothie is designed to provide. This smoothie provides just enough protein to rebuild tissue and maintain stability. A small, carefully measured amount of protein helps preserve muscle, while preventing weakness that can lead to fatigue and falls. Each serving provides the essential amino acids the body needs to repair cells and maintain metabolism. By pairing this protein with low phosphorus, low potassium ingredients, the drink remains gentle on kidney health while still providing noticeable energy. When the body feels stronger, the kidneys benefit too, because a healthy muscle system supports better circulation and glucose control. Studies show that maintaining muscle mass improves overall survival and kidney outcomes. Restricting protein too severely, especially without professional guidance, can actually accelerate weakness and frailty. The goal is not to avoid protein, but to choose it wisely. In this smoothie, balance replaces fear. To make it, use half a cup of unsweetened almond milk or another kidney-safe alternative as the base. Add 1 to 2 tablespoons of kidney-friendly protein powder or pasteurized egg whites, whichever fits your plan. Blend in a small handful of blueberries or a few thin apple slices for natural sweetness and antioxidants. Add ice or a little extra water for volume. This keeps the drink light but satisfying. It can be enjoyed after waking or as part of breakfast, depending on your medical plan. Those awaiting blood tests should wait until after labs, since even small nutrients can affect readings. Always follow your dietitian's or nephrologist's advice on your total daily protein needs. Each person's kidneys tolerate a different level, and personalized guidance keeps progress safe. Within weeks of consistent use, energy often improves, grip strength feels steadier, and movement becomes easier. The body feels less fragile, more capable, and more alive. This smoothie is not just nutrition, it is confidence in a glass, reminding the body that recovery is still possible. And while it rebuilds strength for the day, the final drink helps the body unwind and recharge for the next morning. That last step toward full kidney recovery begins with the chamomile saffron morning reset. Chamomile is known for its natural ability to relax the nervous system. Its mild compounds ease muscle tension and slow the racing thoughts that often keep people awake. When taken regularly, it helps the body fall asleep faster and wake with a more settled heartbeat. For those living with kidney disease, this soft relaxation matters because restful sleep directly affects blood pressure and filtration rate. Each night of quality sleep helps the kidneys clear waste more efficiently and reduces swelling caused by stress. Saffron adds an extra layer of calm. Just 2 or 3 threads release compounds that support mood and stabilize the body's natural rhythm. In clinical studies, saffron improved sleep onset and quality, helping adults experience deeper, more restorative rest. It also supports a balanced mood, easing morning anxiety that often comes with managing chronic illness. This emotional steadiness keeps blood pressure lower and makes it easier to follow daily routines that protect the kidneys. To prepare, brew chamomile tea with 8 to 10 ounces of warm water. Add 2 to 3 saffron threads and let them steep for several minutes. The water turns a soft golden color and carries a light floral aroma. Drink it warm as part of a quiet morning reset, or make it the final evening ritual to encourage better rest for the night ahead. Either way, its gentle effect lasts into the next day, helping the body wake up calmer and more centered. Avoid using large amounts of saffron. Its strength lies in subtlety. Pregnant women and those taking mood or sleep medications should consult their doctor before regular use. This blend isn't about instant sleep. It trains the body to feel safe, rest without tension, and wake without fear. If this video was helpful, please don't leave without subscribing to Kidnease. And if you feel like I truly understood your struggle and offered a solution that matters, type the word relief in the comments. I'd love to know if this helped you.